My research findings are as follows. I started with the decision to admit through the use of a risk stratification tool. The decision to admit patients coming into the emergency room with chest pain has left many emergency room providers leaning towards admission rather than discharge with outpatient follow up. Because of this current practice, some hospitals have implemented pathways to guide the decision making process. This process begins on first arrival to the hospital. The acronym HEART is a pathway used by some emergency rooms for risk stratification and decision making in acute chest pain patients. This tool has been implemented in several healthcare institutions and has proven successful in the prevention of hospitalizations. The HEART score is comprised of 5 components: the H for history, E for EKG, A for age, R for risk factors, and T for troponin. Each component is rated on a scale from 1 to 2, and all scores are summed up to produce a final score. Low risk patients will have a score of 3 or below. However, a patient determined to be of high risk will have a score of 4 or above. In efforts to determine effectiveness of the HEART pathway, Six, Backus, and Kedler performed a study which included patients with an inclusion criteria consisting of any patient admitted to the ER due to chest pain, irrespective of age, pre-hospitalization assumptions, and previous medical treatments. As a result of this study, it was determined that the HEART score helped clinicians to make an accurate diagnostic decision, and it was a reliable predictor of outcome for chest pain patients, which would in turn reduce hospitalizations. Next was the use of patient portals. Since its inception, health information technology has provided greater access to patients and helped to facilitate provider-patient communication. And there have been noted benefits to patient outcomes, including improved patient-provider communication, patient experience, and patient engagement with care efforts. Griffin, Skidner, Thornhill, and Weinberger explain that portals have increased patient access to medications, immunization history, laboratory results, updated allergies, and even advanced portals have allowed for enhanced communication with providers, managed billing, and refilled prescriptions. Furthermore, due to the regulations in the Affordable Care Act, incentive programs for reduction in readmission rates have been instituted, and the use of patient portals have added to the meaningful use requirements. It is also important to take into consideration some limitations of patient portals or lack thereof. Limitations such as language barriers, literary issues, technological barriers, and even socioeconomical confines with owning a smartphone could affect patient compliance with portals. Portals must be user-friendly and designed specifically for patient use. Baldwin et al. Have expressed that if patients are not able to understand the information provided on the portal, and or if the platform is too complex or hard to manage, patients may not take advantage of this new system for access. Therefore, healthcare professionals must partner with patients at the time of discharge to educate and reinforce importance of usage. The importance of follow-up. Another key strategy in reducing readmissions is the importance of outpatient follow-up visits and phone calls. Sheik et al. Shared that healthcare providers should consider performing follow-up phone calls after discharge from the ER in order to ensure that patients who are either low income, who did not complete high school, are able to understand the instructions provided to them. Kane et al. Believed that there was a lack of support and education for patients discharged from the hospital. Therefore, they piloted strategies such as risk stratification and tailoring of care, a specialized phone number for recently discharged patients, standardized same-day summaries to primary care providers, medication reconciliation, follow-up phone calls, and scheduled appointments before discharge. Although numerous studies have indicated that a prompt follow-up after hospitalization can prevent readmission, there are still several large number of patients that do not receive outpatient follow-up after discharge, either because they were not aware of what was needed or expected, did not understand the discharge instruction, or had no means of getting to and from appointments. The importance of diagnostic testing. Once discharged from the hospital, diagnostic testing such as contrast enhanced stress echo in an outpatient setting post-hospitalization can show an improvement in outcomes and cost savings. Yang et al. Performed a retrospective observational study of patients presenting to the emergency room or urgent care center who were considered to be of low risk chest pain. As a result of this study, it was determined that the chest pain experienced by 92 patients who were admitted to the hospital were non-cardiac related. It further established that the management of low-risk chest pain can be done safely in an outpatient setting with the use of stress testing. Dr. Yang and his colleagues recognized in their study that there is a clear association with a reduction in readmission rates and healthcare cost savings through the implementation of outpatient diagnostic testing. The importance of patient understanding of discharge instruction. Patient education is a key process that enriches a patient's and their family's knowledge and perspective at discharge. In efforts to enhance this process, understanding is essential. Researchers have shown that there is a gap between patients' perceptions of the information presented to them at time of discharge and what it is truly understood. Zavala and Schaefer performed a randomized descriptive study to evaluate that patient's understanding of their discharge instruction and to identify areas of confusion about discharge instructions in the ER. Additionally, in an observational study performed by Sheikh et al., it was determined that patients' understanding of discharge instructions in the ER was inadequate, and that patients of different socioeconomic backgrounds may have different preferences for resources to aid their understanding. The importance of community health classes. Public health programs improve patient outcomes. Programs such as health promotion classes for understanding heart health and risk factors can prove beneficial in reducing ER hospitalizations and readmission rates. Plock, Wereberg, and Heidrich performed a descriptive two-group post-test survey on the importance of coronary artery disease educational classes. Their study included patients who were post-cardiac catheterization who attended educational classes regarding coronary artery disease, risk factors, and health-promoting behaviors. They concluded that by attending these educational classes, they scored significantly higher on a post-test survey on knowledge of health-promoting behaviors.